Welcome back to the Pulse. Now, a week today, activities at the various courts in the country will come to a halt following a decision by the Judicial Services Staff Association of Ghana to go on strike. JUSAG says it is threatening this industrial action because President Mahama has refused to append his signature for the release of the funds needed to cover allowances for clothing, rent, and some other needs of the staff. President of the group, Alex Nati, tells Joy News the association has since June 2015 been waiting for the president to fulfill his part of the agreement reached to pay its members consolidated salaries.
We have for almost 2 years now been expecting the president to play his role in respect of the conditions of service of the judicial service without any results. And the Judicial Service Staff Association of Ghana and our rank and file have diagnosed the issue, and we are of the view that we have to issue this notice to require the authorities to take action.
When you say you have spoken about this issue for long, how long has it been?
It has been very, very long.
Since when specifically?
As far back as June 2015, this JUSAG had fully engaged the Judicial Council, and the Judicial Council had issued a recommendation recommending the consolidated salaries to the president for approval. And the president has since June 2015 not done this.
When you say consolidated salaries, what exactly do you mean?
What I mean is that for a session of the staff, the Judicial Council and other stakeholders have resolved to pay some other allowances that the judicial service staff take other than their salary, together with their salary.
What needs are these allowances meeting?
An allowance meant to be paid to a worker is meant to, ease his or her economic, pressure. Some are clothing, some are rent, some are fuel, some are other things that I can't mention offhand. All these things are critical to the judicial service staff, and these allowances existed before you and I.
When these issues come up, who do you primarily report to for resolution? The CJ, the AG, or who?
They are all involved. The AG is a member of the Judicial Council, so she plays a critical role in determining these things, and she was part of the team that approved this. The Honorable Lady Chief Justice is the chair of the Judicial Council, and she plays a critical role in, she is responsible for all these things. She has done her part and has forwarded what they think is right in line with the Constitution of Ghana to the president to take an action. And so the CJ has played her role. The Labor Ministry has also played its role. We have engaged them.
Let's do health. The Government and Hospital Pharmacists Association, GOSPA, has suspended its nationwide strike. The pharmacists have been protesting for the last 4 months over the government's failure to address discrepancies in their market premium payment. The decision to call off the strike action follows an emergency delegates meeting. Raymond Teta, a former chairman of GOSPA, spoke earlier on Joy News Desk.
It was some agreement at a general meeting by delegates representing pharmacies nationwide.
Has government met your request?
Well, we had a series of meetings with the Minister for Labor, and an MOU was signed to that effect that our issues be considered.
So what happens next? Before that, did government tell you or did the MOU tell you when your demands will be met?
Yes, they said somewhere in January next year we should look towards something like that. But of course, that is not the best. But we are also aware that our patients need our services.
So let me find out from you, Mr. Tete, was it a compromise decision? Because you were talking about discrepancies in your market premium. What exactly was agreed in the MOU?
Well, as part of the negotiation process, we were informed that if we remain on strike, then it will be difficult for the engagement process to continue. So we needed to show good faith. Apart from that, the National Labour Commission also took the matter to court, and we were summoned. And we've had 2 sessions already. We have also filed in opposition to their request for us to return to work. We are saying that they have to implement or enforce the implementation of their ruling.
And we know that 3 major things you talked about before you embarked on the strike was there were conditions of service. You talked about interim market premium as well as the structure. Would you say that you're satisfied with each of these according to the MOU you signed?
Well, the MOU has taken on board the issue of the grade structure, and they've affirmed that it will be implemented, and we are looking forward to that. With regards to the interim market premium, government says it is now implementing from January market premium. There's no more interim, and so we'll be invited to negotiate that one. And we think that it will be difficult for our members. I mean, having to give away so much back pay. But then we are looking forward to an agreement on that. Now, as concerns the conditions of service, there's an ongoing engagement with the fair wages. Likely we will start that Monday to resolve the outstanding issue. We are almost done on that. So we think generally there are other aspects that we are not comfortable with, and we'll take them on as they come.
We're still talking health, and President of Sanford World Clinics, Kojo Benjamin Taylor, says there are no standards in health delivery in Ghana. He says the situation where patients receive varied levels of quality care depending on where they live in the country is very unacceptable. Mr. Taylor said this when the Sanford Clinic signed onto a standardized quality assessment program aimed at improving quality of health delivery in Ghana. This is because though access to primary health care has been promoted by players in the health sector, the issues about quality care has been neglected. Kwame Kweku Owusu-Pepa has more on this report.
According to the World Health Organization, 1.4 million people suffer from hospital-acquired infections at every point in time. In Ghana, 1 out of 10 hospitalized patients will acquire an infection. This is because there are no standards in healthcare delivery in Ghana. To deliver these standards of quality and accessible healthcare to Ghanaians, especially the poor, SafeCare has signed an agreement with Sanford Clinics to ensure that people who visit their health facilities across the country receive quality standard care.
So SafeCare looks for partners who look in the same direction and vision. We seek to make the healthcare market work for the poor. So we have a strict selection criteria with respect to who we work with. So Sanford meets that criteria, and that's why you see us having this marriage with Sanford. And that's because, one, Sanford looks at the bottom of the pyramid. So Sanford, by delivering healthcare as a national health insurance service provider, automatically raises the financial access barrier, which then makes the poor able to access high-quality, franchised, promised brand care at almost no cost out of pocket.
Sanford Ward Clinics is a public-private partnership initiative with the Ghana Health Service, which has footprints all over the southern parts of Ghana, providing basic health care to the poor.
Safe Care has certain core business principles about improving quality of service delivery. That seems to also be the same direction and vision that Sanford stands for. They are about standardization. In the healthcare services industry, particularly in Ghana and most developing countries, we find that there are no standards. You can expect different level of services depending on the healthcare facility, whether it's private or public. Standardization becomes very important.
So what does it mean to have standardized healthcare in a hospital? Is this much touted standard and quality care when you feel unhappy or unwell after visiting the health facility?
Safe Care is going to ensure that the patient comes out happy. And if you weren't happy, there are ways or there are processes that you could go on to ensure that you get your happiness. So a nurse didn't speak to you the way you expected. Safe Care will look at, is there a client complaints form which this client can fill? And is there a system that it will propel it to the level where the client's expectation will be met, and the feedback will go back to the client that this was what happened, this is the explanation, we are sorry, next time you will meet again. These are the processes that Safe Care will measure.
My name is Derek Fiancon. This is the place normally we visit. I think they should improve on the general care so that we all have quality care.
Once in the life of every individual, you will fall ill and you require good access to health care. But the quality of the health care you receive is the question. Kweku Owusu-Bepra.
Well, despite delays in the delivery of some building materials, in Soko Hospital is expected to be completed on schedule. Workers at the project site in the Tyne district of the Brong-Ahafo region were feverishly working to meet the October deadline for partial opening when a team of journalists were conducted round. Nestor Kofi Ajuma went along for Joy News.
Maintenance department, power department and the main stores of the hospital have been roofed and ready for painting and equipment installation. Workers are yet to begin roofing the hospital's morgue, the administration and the pharmacy at the time of Joy News' visit. Our cameras capture these workers doing landscaping of the entire hospital, as well as working to get the walkways and drains ready for the October partial opening. Resident engineer at the Nsoko District Hospital, Mahmoud Omran, says most of the work has already been done with the extension of electricity and potable water to the hospital.
We have some challenge before about the material to site, but now already all the material on site. So we are working to do this partial opening on the time. The partial opening, we mean the administration buildings, outpatient department, and also the pharmacy to be ready. The main gate, the main entrance also will be ready.
Administrator of Eurojet, the Invest contractors of the project, Baba Anaba, said he is impressed with the extent of construction and expressed optimism that the project will be completed on schedule. Nesta Kafuyajoma's report for Joy News.
Well, have you eaten an egg today? If you haven't, you may want to try because we're told it's full of protein. Well, as the world marks International Egg Day, the Ghana National Association of Poultry Farmers embarked on a float through some principal streets in Accra today. The association took advantage of the day to dispel myths about the regular eating of eggs, as well as encouraged more Ghanaians to consume more eggs to boost their immune system. My colleague Jennifer Kwama was there and comes through with this report.
Like them scrambled, fried, in cake, in Eto or even drunk raw, today is the day to celebrate that little superfood which is packed full of protein. I'm talking about eggs. Today is World Egg Day, and I've been joined by the Ghana National Poultry Association of Ghana. They're having a float through the principal streets of Jamestown, going to end with a bazaar at the forecourt of State House. We have nurses here, we have passers-by, everybody celebrating eggs on this auspicious day. So as you can see, just because it's an election year doesn't mean we can't take time to celebrate World Egg Day.
The float, which was well attended by students, nurses and school children, took them through the principal streets of Accra, and Joy News spoke to them and asked why did they join and decide to celebrate World Egg Day.
I want to tell them they should forget the myth and do their own thing, at least 2 in the morning and in the evening. That's all. It shouldn't be too much. It should be just 2, and I think that's cool for them.
But you yourself, do you eat 2 eggs a day?
I do. I love to eat egg. I'm good at it.
Why do you like eggs?
Because it's giving nutrients.
Why do you like eggs?
Because it gives me protein. Yes.
But some people say when you eat eggs, you become fat.
Never true.
No, it's a lie. Yes. So how many eggs do you eat a day?
We are advising everybody to take egg, at least 1 a day. Egg is high in cholesterol, but then we have cholesterol that makes you grow fat and one that makes you stay in shape. And egg contains that one that makes you stay in shape. So we encourage everyone to take egg.
President of the Ghana National Association of Poultry Farmers, Victor Pongaje, also took the opportunity to encourage more Ghanaians to eat eggs on a regular basis.
Today, being 14th of October, has been earmarked as World Egg Day. It is being celebrated globally. Everywhere in the world, we are celebrating egg. Ghana, we are using this opportunity to create awareness for egg consumption because egg has been unfairly demonized in the country. So we want people to take that perception from their mind that egg has a high cholesterol because they are not taking egg. It has been proven that even the cholesterol in the egg has nothing to do with the blood cholesterol. So egg cholesterol is a good cholesterol. The body needs cholesterol every day, 300 milligrams. And it is good to eat egg.
Are they producing the quantity of eggs that the country needs?
More than enough now. We have more than enough in the market, except that the people are not buying, they are not eating. Do you know that egg contains the best quality protein? It contains the vitamins, it contains the antioxidant, the minerals, the folate, the choline. Choline helps the function of the brain and the formation of brain. So it's always good to eat egg. If you are somebody who easily forgets things, begin to eat eggs to improve the function of the brain, because egg contains choline, which does that job.
For Joy News, I'm Jennifer Ikwamwa.
We're taking a break. When we come back on The Pulse, Jennifer Kwamwa joins me to further discuss this wonderful day. It's called the Egg Day.